settings. Dr. Leslie is recognized across United States and globally for her leadership in cancer rehabilitation program development and patient-centered education. She has trained countless healthcare professionals, contributed to major international organizations, including the World Health Organization, and supported guidance to the patients and all over the world. Her work spans clinical care, research, authorship, and teaching. She also has coordinated one of the largest cancer rehabilitation program in the United States, authored key chapters in oncology reference text, developed educational platform for the patients and survivors, and received multiple awards for excellence and leadership in the field. Welcome, Dr. Les.
Hello. Thank you, Dr. Masur, and thank you, Dr. Cohen, for having me here. Let me pull up my slides. And you're also going to meet my cat, Charlie, who is kind of needy right now. So I'm excited to talk with you all today. And good afternoon from the United States, and good afternoon to all of you in the Eastern Hemisphere. It's an honor and a pleasure to be with you. I hail from pretty much smack dab in the middle of the United States, North America. So I'm just on the Great Lakes region of the United States. So I live very close to Lake Michigan, which is a beautiful part of the country. And again, welcome everyone. And thank you, Dr. Masur, for that introduction. So what we're going to cover today, we'll certainly talk about radiation, but anybody who has had radiation has probably also had surgery. And there are some cross-pattern or cross-linked side effects that happen both from radiation and surgery. So we're going to talk about surgery as well today a little bit. And we're also going to talk about a lot of the side effects that happen in survivorship as a result of surgery, chemotherapy, and radiation. So we'll kind of hit all of the above. So the biggest thing I want to get across today is how important it is to, if you're able to work with a physiotherapist. So in the US, we're called physical therapists. In the rest of the country, we're physios. It is so important that people realize that there is recovery possible after cancer treatment, because it is very, very tough on the body. And just like somebody who has a car accident or a stroke, they automatically get physio, where people with cancer often don't. And you can see how if somebody has a stroke, they recover from their stroke, the stroke is done. But if they don't have a physio help them, they're not going to be able to return to full walking or full self-care or full social engagement. So the same with cancer. All right. Cancer happens, treatment is done. And if people don't get physio, or if they don't get support in recovery, they often don't recover as well as they possibly could. So that's kind of the big underlying thing that I want to get across today. So we'll talk about regaining strength, comfort, and mobility after surgery and radiation. We're going to talk about minimizing fatigue, which is one of the number one side effects of radiation and chemotherapy. And then we'll also just quickly talk about lymphedema risk reduction, because people that have radiation may be at higher risk for that. And then we'll talk about how important exercise is, not only recovering after radiation and surgery and chemotherapy during those things, but also using exercise to reduce the risk of the cancer coming back. Yes, that has been proven in the science, proven in the literature, proven in the research, that cancer survivors who exercise die less often, have less cancer recurrence, are less sick, and have fewer problems than cancer survivors that don't exercise. So we'll talk a lot about that today as well. And that includes weightlifting, if you so choose to do that. Every human on this planet, regardless of age, regardless of health, should be lifting weights with their arms and legs at least twice a week. Okay. And the sicker you are, the older you are, actually, the more important it is to lift weights and keep your muscles strong. So that's kind of what we're going to cover today. All right. And I'm going to throw out right away that, as we mentioned, fatigue is the most common side effect from cancer treatment. Not only is it the most common, it's usually the most distressing as well. And the best treatment for cancer related fatigue is exercise. I shall repeat the best treatment for fatigue is exercise. Now, if that's new to you, that might feel a little counterintuitive, but if you are weak, and have difficulty walking, the best way to change that is to strengthen your muscles and strengthen your heart and strengthen your lungs. You'll hear me say several times that sitting on the couch will never make you stronger. So it's important to get up and move. So when we talk about exercise, that's going to look different, excuse me, for everybody on this call, because exercise is going to be moderate for you on that particular day. So if you are somebody who's 20 years old versus somebody who's 80 years old, your moderate exercise is going to look different than each other, but they're both moderate. And again, it doesn't matter if you go to a gym or go to a class or you exercise at home with weights or with just a water bottle. That's all fine. Your heart and your lungs don't know where you are. They don't know what you're doing. They just know that they need to work a little bit harder. So exercise is attainable for every person in some way, shape, or form. Now, the research says that cancer survivors should be getting about 150 minutes a week of exercise. So that is about 2.5 hours. So that's the minimum target goal. All right. If you can only do 10, then you do 10. If you can do 5, you do 5. Anything is better than nothing. But the goal that you want to work up towards is about 20 to 30 minutes a day of something as simple as walking, all right, at a pace that's comfortable to you. About 5 to 6 days a week, we want to do some type of aerobic exercise for our heart and our lungs. And then twice a week, we should be doing something to strengthen our legs and our arms. Now, that could be something as simple as stand up and sit down 5 times from a chair. That's great exercise for your legs. You can do push-ups against the wall. So even if you're older or weaker or have arthritis, that's a nice, easy way to get some strength into your arms that's not too stressful. So that's kind of the goal. Now, people are like, oh, 20 to 30 minutes a day, that's a lot. Yeah, that can be a lot, especially if you're caring for family, if you're caring for a home, if you're working a full-time job. But remember, there are 10,080 minutes in a week. You have 150 minutes to carve out for something that is crucially important to not only improve the quality of your life, but the length of your life, and it can even impact your overall survival. So putting yourself on your own schedule, making yourself your top priority is critically important part of being a human. So it's really important to make yourself a priority and get this scheduled on your own calendar. It is that important. So as I mentioned, people in physio, people that are returning to full exercise, improve the quality of their life. They increase how long you will live, okay, because you're improving the two biggest things that kill humans on this planet. Number 1 is heart disease, and number 2 is cancer. And we know that exercise and strength improve longevity for both of those. So again, there's no excuse for us not to be exercising regularly in our own way for our own body. All right. And I also want to remind people that it doesn't matter what kind of cancer you have or had, because most cancers will require surgery, chemotherapy, and or radiation. And it's the surgery, chemotherapy, and the radiation that create these problems in the human body. So regardless of what kind of cancer someone has, they should be exercising. They should be going to physiotherapy if they can. Now, when you think of cancer, we don't automatically think of exercise or rehabilitation or physiotherapy. We think of surgery, chemotherapy, and radiation, right? But when people who've had surgery, chemotherapy, and radiation start talking, these are the things they complain about. Fatigue is number 1. Pain is number 2. Weakness is number 3. numbness and tingling, limited mobility, difficulty walking, balance problems. These are physio problems, right? These are problems that will respond well to exercise, strengthening, and rehabilitation. So it's a got to become a critical piece of every cancer care plan. So I know you people are from all over the world. So today we have just created about 50 new advocates for making sure that people in cancer treatment are continuing to exercise, continuing to move, and then once they're done with treatment, again, pushing towards full strength, full mobility, and activity. Because it is a game changer, and we all need to really be pushing that narrative with our communities, with ourselves, and with our cancer treatment teams. So, ASCO here in the United States is the same thing as ESMO, the European Society of Clinical Oncology or Medical Oncology. And we know, they all know that chronic pain and fatigue can be a serious consequence of surviving cancer. Everybody knows this, right? And the prevalence of pain in the cancer survivor population, and I believe there's about 53 million people on this planet, at least, who have a history of cancer. The prevalence of pain in these people is reported as high as 40%, and fatigue is even higher. So these are huge problems that we really need to start paying better attention to. And then again, we are going to have, because we have a larger global population, because our population is getting older, that means that more people are alive and older to get cancer. So this problem is not going to not going to go away. It's actually going to escalate in importance and prevalence. So it's something, again, that each one of you can do something about to help yourselves, your loved ones, and the people coming behind you. All right. So again, studies very clearly show that physio and exercise not only improve symptoms, okay, they improve overall survival. All right. So this isn't just, oh, I feel better. This is you're going to live better. You're going to live longer if you're moving. So again, quite simply, we know that our radiologists and pathologists create a cancer diagnosis once something is found, and then the next team will develop a cancer treatment plan based on what type of cancer it is, who is the person, what stage is it, etc. And then it's these surgeries that create the side effect profile that really makes cancer really, really difficult to treatment to get through and to recover from, and then makes survivorship very, very difficult because the list is long. But again, I want to reiterate that these symptoms, everything on this list, can be improved with physio and exercise. And again, we want to start physio and exercise as soon as possible when treatment starts. We don't want to wait until people are weak and disabled before we start. We want to start physio right away once cancer treatment starts. It's never too late to improve, but we don't want somebody to lose everything and then go, oh, okay, now we'll help you. We want to help people right away. So, to get more specific, side effects of typical cancer surgeries, and again, there's hundreds of them, and they're all very different from each other. But typical side effects after a cancer surgery is similar to somebody who's had a knee surgery or a shoulder surgery. So, things like pain, limited mobility in that particular body part, scarring, and soft tissue changes, so skin changes, are very common after cancer surgery. And we're going to talk a lot about that today. But people will also have muscle weakness, limited function, and sometimes can have swelling issues after cancer surgery. For chemotherapy, the biggest side effects we see are fatigue, weakness, pain, heart issues, numbness and tingling. People can gain weight, people can lose weight, they can lose muscle, they can lose bone, and all of that leads to a difficulty in maintaining your normal ability to do the things that you do every day, whether it's drive or go to school or go to work or take care of your family or take care of your home or take care of yourself. And then from a radiation perspective, we're going to see during radiation, while people are getting their radiation, which usually is every day for several weeks, the biggest side effects are number one, the skin changes wherever it is that you're getting radiated, whether it's to the chest, the breast, the rib cage, the spine, the leg. You certainly are going to see some skin change, and that can cause some pain. But typically, the largest side effect of radiation then is going to be the fatigue, the tiredness that happens from the radiation itself. And again, this can lead to pain and loss of function. But here's the important thing to point out about radiation. We call it the gift that keeps on giving, because the radiation may finish and then your skin heals and everything seems fine. But then all of a sudden, 6 months later, a year later, you're like, wow, that skin just feels really hard. It feels really tight, and I can't move as well as I used to. And every time I move, I feel weak and I feel tightness and stiffness in that area. So that is scar tissue and radiation fibrosis, which I'm actually going to show you in just a moment. So the last kind of advocate slide I wanted to put up here is we all talk about successful cancer care. Well, what is success? Well, of course, we want to get rid of the disease. We want to get rid of the cancer, or we want to slow it down. That's success, right? But we also need to add into that success picture, yes, we want to stop the disease. But we also need to get people back to who they are or who they were. So their activity level and their comfort level. And right now, that's not always happening to the best of our ability. So that's truly what cancer success is getting rid of the disease and getting people back to their comfort level and activity level. That is successful cancer care. All right, so we talked about all these fabulous things that happen when cancer patients go through physio and exercise weekly during their treatment. All right, so let's take a quick look at cancer surgery. All right, so here are the lymph nodes. And if there is a tumor somewhere in the body, one of the ways it can spread is through the lymph nodes, which is why most cancer surgeries will include, obviously, removal of the tumor, but the surgeon will also remove some lymph nodes from that general area. And then the lymph nodes will go under a microscope and they will look for the presence of cancer cells. So if there are cancer cells in that lymph node, it tells your medical team, these cells have tried to get out. So we may need to alter our treatment to address that. So we may add radiation or we may add chemotherapy. If there are not cancer cells in those lymph nodes, maybe somebody they need to treat the area with surgery and radiation, but they may not need chemotherapy. So that's why they remove lymph nodes during a cancer surgery. So what happens with cancer surgery is the surgeon has to take out, obviously, the cancerous area, and they don't cut through the cancer, they cut around it. All right. And then take not only the tumor out, but a clean margin of tissue around that tumor. So sometimes quite a bit of tissue can come out, and sometimes a lot of skin can come out. So this is an example of a mastectomy for a breast cancer. So, and yes, men can get breast cancer. Why? I actually just did a talk for a male breast cancer group, so that's why this gentleman is in the picture for a mastectomy. But my point is with this skin now missing, this top piece and the lower piece have to be kind of pulled together and sewn closed. So now this person might have a difficulty raising his arm over his head because there's just not enough skin to allow the body to move normally. So that happens fairly commonly in some cancer surgeries. Another issue is now you're looking at that same person, but now you're looking at them from the side. So normally we have skin, then we have breast tissue, and then we have the muscle layer, all right? But after the cancer surgery, you now have skin, okay, laying right on top of that muscle. And sometimes that skin can stick to the muscle. So again, it causes discomfort, it causes stiffness, and I just can't move that body part as well. All right. So after cancer surgery, you can see two things. You can see a loss of length, so it's just the skin's not long enough. And sometimes it can also just kind of stick from scar tissue because of the changes in that tissue after the surgery. So here is a perfect example. So scar tissue, normal tissue, it's nice and thin, it's nice and parallel, it's not glomped together. And then here on the right, this is scar tissue. And again, you can see it's all stuck together. It's very disorganized. It's very thick. And again, if it sticks to normal tissue, every time this person moves, they're going to say, oh, that just feels tight. It feels very hard. It feels very uncomfortable. And sometimes this can be painful. So, what I'm going to do now is show you a picture of nothing gory. It's not going to be bloody, but it's going to be a surgical picture of kind of a chest wall that is open so you can actually see this muscle. So, if you'd like, it's not gory, but I'm just letting you know. So, but if you choose to just, you can turn away or just know that it's coming up. So, here's that photo. All right. So now here is the person's skin. So this is the left chest. All right. Here's the left shoulder. And here is the chest wall muscle. This is the pectoralis major muscle that is in the chest. Okay. So now you can see that this skin is now going to lay right on top of this muscle and it can stick. All right. Now I'm going to show you a picture of this same chest wall. Okay. 1 year later. And here's that photograph. Okay. So this, my friends, is scar tissue. Okay. So the muscle's underneath there, and here's the skin. This person was going back into the operating room to have breast reconstruction, which is why they're reopening the chest a year later. Okay. So this is scar tissue. And this is a normal human physiological response. You can't change it. I can't change it. Your physician can't change it. Medication can't change it. It just happens. Okay. Now, I will let you know that this person was a patient of mine. So during this year-long phase that it takes for this scar tissue to develop, she was stretching, she was moving, she was lifting weights, she was exercising, she was mobilizing her skin. So in the presence of this scar tissue, she had no pain. She had no limitation. She had normal strength, normal function, and was very active. But you can see how if somebody doesn't move after their surgery or after their radiation, that scar tissue can kind of get really tight and really thick. And then once you try to move, you're like, oh, now I can't move. So in the first year after radiation and the first year after surgery, it's really important that we encourage people to stretch and to move and to mobilize, to keep that skin in that area moving. So as the scar tissue does develop, that it develops loose and long so it doesn't stick to anything and cause people pain down the road. Okay. Now, if this scar tissue does cause people pain down the road, we can still fix it, but it's nice to not have a problem in the first place. And again, this is just for the upper body. But again, this scar tissue, whether you have surgery to your spine, whether you have surgery to your pelvic floor, whether you have surgery to your leg or your chest wall or your back or your neck or your face, there's muscles underneath everything. And the scar tissue can impact that. And again, here is a drawing of why skin is important. So if your radiated skin or your post-surgical skin is really short or really tight, not only can it cause discomfort, it can also limit your mobility, but it's also going to compress all the veins and arteries and lymphatics underneath. Which in itself can cause difficulty. So we want to make sure that the skin is loose and that you are moving well so you can have good function and good comfort, but you can also have good function of the tissues underneath that skin. All right. So this is a gentleman who has had a mastectomy. All right. And you can see here he has also had radiation to this chest wall. So for those of you who have had radiation, you may notice that your skin sometimes, even though radiation has been done for months or years, your skin is still a little discolored. That's totally normal. Okay. But again, I want to make sure that in the next year that this skin stays mobile, stays loose, so it doesn't stick underneath, that it compresses and then it bends. And then it is long enough for Clyde to get his arm over his head. Okay. So some of the ways we do that is just simple stretching. Nothing magical, nothing complicated. We just want people to, again, based on where your radiation was and where your tightness is, just simple stretching exercises that you can do right at home. So this is a nice overhead stretch that's going to stretch the chest wall. It's also going to stretch the abdomen. Here's a nice stretch for anybody who's had radiation or surgery to the underarm or to the lateral rib cage or to the chest wall for lung surgery, breast surgery, melanoma surgery, lymphoma surgeries or radiation. And again, here's a nice stretch to open the chest wall, just sliding your arms up and down the floor or your bed or whatever you're lying on. And I'm going to show you a quick little video of this stretch because it's this is David, and he's going to demonstrate this stretch for me. So if you've had surgery to your shoulder, to your chest, to your lateral chest, to your abdomen, to your upper back, this is a fantastic stretch that you can do. And Dr. Cohen is going to get you these slides. But rotating your leg, so he had surgery on his left chest. So he's going to rotate his knees to the right first and then stretch this arm out to the side. Okay, and you can just kind of let it, and you'll feel that again, pulling and stretching all the way throughout. I'll run that through one more time for you. So roll your knees to the opposite side of your surgery first, and then keeping your arm flat on the floor or the bed, you're just going to slide it out to the side. And this is a fantastic way to stretch the skin of the underarm, of the chest, and the abdomen really nicely. Again, something you can easily do at home. Okay, thank you, David. All right. So let's switch real quickly to how can you best reduce your risk of getting lymphedema after a cancer surgery. The first thing I'm going to say is you need to talk to your surgeon to find out what your risk actually is. Is it a 1% risk? Is it an 80% risk? And even if you talk to somebody with the same type of cancer that you had, because your surgery may have been different, because your radiation may have different, because a different number of lymph nodes came out, or in a different location of lymph node removal, is really what you may have a completely different lymphedema risk than somebody with the same type of cancer. So always talk to your surgeon. Say, hey, what is my exact risk of lymphedema? And they can give you a better idea. Okay. But we know from research that when people regain full mobility of the skin, full mobility of the body parts, and regain all of their strength back in their muscles, that the lymphatic system works better. It works happier. When people move more, their lymphatic system moves more. So gone are the days when we told people to rest, we told people to take it easy, we told them not to lift heavy things, we told them no repetitive exercise. All of that was wrong. All right. The more you move, the more your lymphatic system moves. The healthier you are, the healthier your body parts are, the healthier your lymphatic system is. Okay. We also want people to either get to a healthier body weight, okay, or maintain their healthier body weight. For some reason, when people gain weight after treatment, which many people do because of all the changes they've been through, that actually increases lymphedema risk a little bit. So we ask people to kind of either work towards moving towards a healthier body weight or staying at a healthier body weight. We also want people to be careful of getting an infection in that involved arm or that involved leg, all right? Because that puts an extra load on the lymphatic system and that can precipitate a lymphedema. So that doesn't mean that you can't go golfing, that you can't go play in the ocean, that you can't dig in the garden. It just means, or, work a full-time job in a factory. It just means if you cut or scrape the skin around the area where your lymph nodes were removed, we want you to just be careful to keep it clean and keep an eye on it until it heals. If it looks red or is uncomfortable, we want you to call your physician's office and they'll probably give you an antibiotic to protect that area. Okay. And then again, the last thing is regular exercise has been shown to decrease your lymphedema risk. And that is a wonderful thing because exercise reduces recurrence risk for your cancer. It reduces the volume or the load on your heart. It reduces side effects, and it also is going to decrease your risk for lymphedema. So and it also helps your brain for people that have cognitive fog after cancer treatment. So exercise is just really, really a good thing. And the bonus thing is it's also going to reduce your risk of lymphedema. Okay, so let's talk about fatigue really quick because, again, that's the number one side of radiation. It's also the number one side of chemotherapy. So it's as high as 90% of people who go through radiation and chemotherapy will report fatigue. It's just that common. Now, unfortunately, when radiation's finished, when chemotherapy's finished, people say, treatment's over, but I still feel tired, sometimes for months or years after the treatment's over. And again, it can be incredibly distressing and incredibly life-changing. Again, we're going to tell you that the number one treatment for fatigue is exercise. And I've put this slide up already before, but again, we're going to remind you that, again, if you are super fatigued, if you are very weak, if you have other medical problems, or you're older, then just literally you can start with 2 to 3 minutes of an easy walk around the house. That's fine. Slow is better than no, and anything is better than nothing. So just 2 minutes is better than no minutes. Standing up from the couch is better than sitting on the couch, and then you can sit back down again. So getting your body slowly moving, and over time, just asking your body, last week I did 5 minutes every day. This week I'm going to do 6 minutes every day. Next week I'm going to do 7 minutes every day. Just slowly build up because all of that helps with the fatigue. And again, doing simple things for your arms and your legs. You can do push-ups against the wall. You can stand from a chair. You can just literally do this 10 times. Just things to challenge your muscles are all going to help you recover from that fatigue after radiation and after chemotherapy. So let's talk more about, so all of you have seen the linear accelerator. This is the machine that most cancers are treated with radiation with external beam. Sometimes they put the radiation right into the tumor itself, but most of the time, 90% of the time, it's going to be done with a machine somewhat similar to this. So to get to the tumor, wherever it is, okay, the radiation's got to go through the skin. Sometimes it's got to go through muscle. And sometimes, again, that can change the thickness of the skin. It can change the thickness of the connective tissue, and it can cause fibrosis or scar tissue. And again, that doesn't happen overnight. It takes a good year to a year and a half for that scar tissue to develop. So that's why after the radiation is done, we want you to stretch for at least, even if you feel great, we want you to stretch for at least a year to a year and a half. So as that skin is slowly tightening and thickening, that you're still, whoops, I just knocked my lamp over. So as that tissue is thickening and tightening, that you're moving that your leg or your arm or wherever it is that you had radiation, so that as it heals nice and loose and nice and soft, and nice and supple. Okay. And again, it's going to the radiation side effects is sometimes your skin goes back to looking normal. Sometimes you may get a permanent darkening of the skin. Those little spidery red marks in some cases, some people have those. Those are totally normal. That's just your skin trying to get more blood flow into that area. But again, in some people, the skin, the muscle, and the connective tissue between the skin and the muscle can get really, really tight. And that doesn't happen overnight. That happens usually months or a year or so later. And also, as I mentioned earlier, if the skin gets really tight, if the muscle gets really tight, that can actually increase your risk a little bit of getting lymphedema. So again, I'm going to show you some more slides. These are not surgical slides. They're people, but people who have had radiation, just so you can see what this looks like. And you'll probably recognize some of this in some of you. So this is a gentleman who has also had radiation to his left chest wall. Now, he just got done. So again, burning of the skin, blistering of the skin is very, very normal. And again, it doesn't matter whether you have skin from Ireland or skin from Africa. That doesn't dictate how much you burn. What really dictates how much you burn is where is the dose of radiation going and how deep is it going and how much is it. So it's really going to be determined more by your individual radiation plan than really what color your skin is. So people who have really dark skin can burn horrifically, and people that have very light skin sometimes don't have any trouble at all. So it's more the radiation dosage and location that impacts how much you burn versus your skin color. But again, you can see that here he just finished up radiation after, I believe, about 6 weeks. Okay. But look at how well he's moving. That arm is going all the way up over his head. Now, as this heals over the next year, this is going to tighten and thicken. That fibrosis and scar tissue is going to happen. So I'm going to have him keep moving, even just once a day, for 15 seconds. It doesn't take hours of exercise. It doesn't even take minutes of exercise. But just again, as this gets tighter and thicker, that we keep moving so that doesn't become problematic. All right, and this is Bill's right armpit, and this is Bill's left armpit. And again, usually you can't see fibrosis, but here in his case, you can. He had lung cancer and the cancer came back in his underarm. So they had to radiate it pretty aggressively. So you can see here's those little blood vessels we were talking about, which are totally normal. But you can see the skin is very leathery and very thick. Okay. We can still make that softer. We can make it longer. So it still looks the same when we're done, but he was able to move his arm much better. His arm got much stronger, and he was much healthier and happier. And again, same thing. We're going to tell you, we want you to target 150 minutes per week of exercise during radiation and then after radiation to maintain your strength, your mobility, and your energy. And remember, fibrosis post-radiation can happen over a year to a year and a half sometimes. So you just need to be on a long stretching program just to make sure, again, as that tissue thickens and tightens, that it stays loose and it stays long. Let's just quickly, in our last 2 minutes, talk about chemotherapy. Because again, a lot of side effects happen during chemotherapy. And guess what? The exercise prescription for home is going to be pretty much the same. Again, targeting during treatment about an hour and a half, and in survivorship targeting about 2.5 hours. Again, you may need to build up to that, but again, we want you strengthening your heart, your lungs, your arms, and your legs. And again, that can be very, very simple. You can do it in your own home. You don't need anything magic. You don't have to pay for anything, but you just need to be moving. All right. So I want to show you some pictures from the clinic here where I work. This is a gentleman with lymphoma sitting on the bicycle. This is a woman with colon cancer doing her weightlifting exercises, and you can see her chemotherapy port is here. She's doing well. This is a woman with leukemia who is doing some exercise, and she has 0 blood count, so she needed to be protected from infection. But even if your blood counts go down, which often happens with radiation and certainly with chemotherapy, exercise is still safe if you have a low white count, if you have a low platelet count, and if you're anemic. Exercise is still okay to do. We just may need to modify it to help you because you're so tired, or help you because you are at bleeding risk, or you certainly shouldn't go exercise in public if your white count is down. So this is why it's nice to have a physio help you with this. All right. But ultimately, if you are in radiation, if you are in chemotherapy, we want you sweating and smiling. So we do want to get used to the fact and normalize the fact that people in cancer care can and should be exercising both during treatment and certainly after to recover. All right. And survivorship, as you know, is plagued with side effects. So every cancer survivor I think I've ever talked to said, yeah, just when you think it's over, it's not always really over. All right. So again, physios can help you with that continued fatigue, with the bone density, and with neuropathy, with the chemo fog. All of that stuff can be helped with physio. And for those people who are on hormone treatment, whether from like a prostate cancer or a breast cancer, that too can cause massive side effects. So changes in body composition, muscle weakness, bone density, changes in mood. Again, exercise and movement will not completely eliminate, but can certainly take a lot of that away, and that's really, really important. And for those people with chemotherapy induced neuropathy, the numbness and tingling in the hands and feet. Okay. Exercise, again, is not going to completely eliminate it. All right. But you still may have numbness and tingling. However, if it starts to make people stop walking, or they start tripping, or they have trouble standing on one leg to get their clothing on, or they have trouble getting up and down the stairs, that's not okay. So we want to get you into physio or make sure that you stay exercising. So even if your feet are numb, we still want you walking. Even if your hands feel numb, we still want you doing and using them. Because if you have a neuropathy, I'd rather have you have neuropathy and be strong and healthy and moving versus having neuropathy and being weak and stuck on the couch and not being able to do anything. We certainly don't want that for you. And again, my take-home point is after cancer, cancer, we want you to be as healthy as possible. But afterwards, you deserve and should expect to return to full strength, full comfort, full mobility, and full function after cancer treatment. So again, if that is not true for you right now, start with just taking a simple walk, start moving, start stretching. And if you need to, talk to your physician about getting you to physio. I have been to London and Europe, and they're there. I know they are. You need to look around for them. But there are physios in Europe that and all over the world that do take care of this stuff. So thank you so much for your time. It has been a pleasure to hang out with you. I know that we have time for some questions. So what I'm going to do is stop sharing my screen here. All right. And either Dr. Masur or Dr. Cohen, do you have any questions popping in? But again, thank you guys. It was a pleasure to hang with you today.
It was a pleasure, Dr. Leslie. Just one question. What do you advise for one change if you would to help regain confidence after treatment?
That's a great question. So what I think is, I think it's interesting how people just assume because I've had cancer, I should be miserable. Because I've had cancer, I will never be the same. And sometimes little pieces of that are true, but I think that also is very damaging because people should expect, you know what, I should be able to walk around the block. I should be able to get my energy back. I should be able to reduce my pain. So just not tolerating side effects just because you think you're supposed to have them is step number one. Just expect more. Like, I don't feel good. That's not okay. What can I do to make myself better? Would be step number one. Just expecting more for yourself. And then number two is just start taking simple walks. People make exercise too big, too complicated, too hard. You don't have to go to a gym. You don't have to spend hours. Literally just say, if you can't walk 6 minutes, then walk 5. If you can't walk 5, walk 4. And just start there with a simple, easy walk that feels good. Exercise should feel good. So do something for your body that feels good, and then just progress a little bit every week.
I have another question. How about how do you deal with the fatigue, and what are the tools like to help help regain the strength and get rid of that fatigue that you
Yeah.
feel more?
Yeah, so during treatment, it's really tough because for radiation related fatigue, it starts like in week 2 or 3, and it just kind of gets worse and worse and worse and worse. With chemotherapy, it goes up and goes down, goes up and goes down. The fatigue does because of where you are in your treatment cycle. But in both of those during treatment, on days when you don't feel well, you walk 5 minutes. On days when you do feel well, you walk 30 minutes. But finding something every day, 5 to 6 days a week, to somehow move your heart and your lungs, somehow move your muscles, is the best way to combat fatigue. Right. So a tip I usually recommend for people is engage your friends and family to help you because it's hard to do that when you don't feel good, right? You're like, I don't really want to get off this couch, but you really need to. So what I tell people is have your friend call you every morning at 10 a.m. and say, hey, did you exercise yet? Hey, can I go for a walk with you? I have people call family and friends from all over the country and just say, hey, it's 10 o'clock. Did you walk today? So helping people help you stay accountable is a nice little tip. But once people start moving, they realize, wow, this actually feels good. All right. So do things that feel good. Do things that you enjoy. Because if you do something that you don't like, you're not going to do it again. Humans are smart. They're not going to do things that they don't want to do. So pick something that you like and that is doable for you and accessible, right? I don't like to swim. So if I don't feel good, I sure as heck ain't going for a swim. But I like to walk. I love to bicycle. Now I'm literally in the middle of a blizzard, so I'm not going to bicycle outside today. But I can certainly bundle up and take a walk, or I can walk in my basement. So there's always ways to do something, but find something that you like and that is sustainable and that makes you feel good.
Yeah, I think that is, I think, the best motivation you have for exercise and walking and stretching. Any other you would like to give advice on motivation, or like you just have to keep moving
Hmm.
because the fatigue in the radiotherapy.
Yep.
So, any motivational advice you would further like to give?
Yeah. And I think it's important. There's a lot of toxic positivity in cancer. You got to be strong. You got to stay due. You got to just have a positive attitude. And that's true. So I will always say that it's good for you to keep moving. But I always say 5 to 6 days a week because you can take a day when you just say, you know what, I'm staying in bed. You know what, I'm going to kick, I'm going to scream, I'm going to complain, I'm going to cry. That's healthy to do. So you have to find a balance between resting and moving. So you can't expect yourself to move every single day. You can't expect yourself to be perfect every day, and you don't need to be. So move some days and rest. But if you're only resting, you are going to start losing function, losing strength, and losing part of your life. So moving is good, but remember that kicking and screaming and complaining and not being perfect are also part of recovery.
So you can have a cheat day, I guess.
Yes.
In that.
Yes, you can have a cheat day. Absolutely. And my goodness, after going through cancer treatment, you deserve a cheat day, right? Go have some ice cream. Go have your favorite snack. Go watch your favorite movie with a friend, or go to the park, or do something that stimulates your brain, or sleep in and stay in your pajamas all day. All of those things are good ways to help you recover. They just need to be balanced.
Thank you. Thank you so much, Dr. Leslie. Thank you.
We have a question as well from somebody in the audience that says, "Do those red marks ever go away?" And actually, I could have asked that question because I had radiotherapy. I have no idea when, about 10 years ago, and I've got like spider red marks all here, and
Mhm.
it's very I can't stretch it, and I wish I'd heard your talk
Yeah.
before because
It's never too
so
late to stretch, though. You can still fix that. So go ahead and do
oh
that stretch. Yeah, it's
oh
never too late to fix that. You can't fix
okay
so those little spidery veins that you're talking about. Those are going to be there,
right.
right?
Yeah.
And then for the person who asked the question, the skin, usually at whatever it looks like at 6 months, the color is probably what it's going to be. Okay. Um, but in the first usually 6 months, the color the darkened color will typically fade away. But if you're 6 months out and you can still look in the mirror and go, oh, I can see where I got radiated, then you're probably that's going to be the way it is. But so the color we can't change. But that tightness and the weakness and the stiffness you can certainly improve. Even if it's decades later, it will still respond to stretching. So go back through the slide deck, do those stretches that you see, and then certainly do the stretch that David's doing. You will be surprised how tight you are. So thank you for that question.
Yeah, I need to exercise.
Yes, you
I need
do.
to stretch and everything. Yeah, thank
Mhm.
you. Sorry. So yeah, fabulous. Sorry, hand it back to Sahar now. So yeah. Oh, she's muted.
Oh,
Okay, your connection's getting a little scattered. Oh, now you're back. Okay.
Um, I think that's good. And we have like talked about the things.
Fabulous. All right, so I will just I'm going to switch off the recording now, but stay with us whilst we switch off because we still have some things to say. I think that was honestly, I keep saying it, but I wish I'd had that talk when I had radiotherapy. I think it was very valuable. Thank you very much. I'm going to switch off
My
the recording.
pleasure.